Healthy Wednesdays, brought to you by the sponsors of MomsEveryday.com.
Most of us love to see the flowers start to sprout and the trees begin to bloom, but for many people this also signals the start to allergy season. Dr. Kurt Kinberg is here from Allergy, Asthma, and Immunology Associates to teach us about hay fever and allergies. Hello, Doctor.
Hi, Taryn.
Nice to have you here.
Thank you for having me.
What exactly is hay fever? We always hear about it. What is it?
Hay fever involves inflammation in the nose and the sinuses, and it's an altered immune response that people have. It's a major medical problem. It affects 50 million people in the United States, and that's 30 to 40% of kids and 20% of adults. And it not only triggers the typical hay fever symptoms, but it severely can affect the quality of life. And people often feel tired, kind of worn out, decreased ability to really concentrate, and so it all adds up. But people need to know if they get a proper diagnosis and they get tested, they can be put on some treatment that really can allow them to take control of their allergies.
I know so many people who have never had allergies, and then all of a sudden it flares up. Can that happen to folks?
That's true. You can develop at any time in your life. It depends on sometimes what you're exposed to, and allergies can change.
And I suppose if you move to a different area of the country, that happened to us. When we moved to Tennessee, we noticed a few more allergy issues.
Exactly right. We have people that move here and say, listen, I've never had any allergies ever until I moved here. And a couple of years after they've been here, they might have developed new ones that they weren't exposed to there.
So how do you diagnose an allergy, and then how would you treat it?
Well, we generally take a really good history and look at some of the different symptoms that they might have. Usually it's like coughing, sneezing, runny nose is plugged, frequent sinus infections, and some people have year-round, some people have seasonal, or a combination of both. We look on physical exams. Sometimes people kind of look beat up once in a while. They might have the shiners, which is the dark circles under your eyes, and many people have a nose crease, which is a little line on their nose from frequent rubbing or doing the allergic salute, we call it.
And then for treatment then, I mean, I guess I've heard about the back test where you would prick somebody's back?
Yes. So there's a scratch test, a simple test that helps us diagnose what they're allergic to. There is a blood test too. But then we can tell them, okay, this is what you're allergic to. These are some of the things that we need to avoid, and helps us that way.
Okay, well, thank you, Doctor. Good advice today, dealing with allergies. So for more information on hay fever, log on to MomsEveryday.com, find the health button, and click on the allergy and asthma page.
Moms Every Day, weekdays at 8:55 a.m. is brought to you by the sponsors of MomsEveryday.com.